Stay tuned because today we are diving into the fascinating world of oral systemic health and specifically addressing a critical question: do extractions matter? More importantly, do extractions matter to your overall health? This review will examine 2025 research on this topic, helping us all better understand the complex relationship between dental extractions and systemic health. And don't miss the "What does it all mean for me?" section, where we'll discuss key takeaways and practical applications. So let's dive in. Recent investigations confirm that tooth extractions, particularly in medically vulnerable populations, trigger transient bacteremia, systemic inflammation, and postoperative complications. In specific contexts like diabetes, hypertension, and CKD, post-extraction responses are altered. Full mouth extractions for advanced periodontitis markedly reduce systemic inflammatory biomarkers, whereas partial or prophylactic extractions can increase cardiovascular or infection risk. Integrating systemic risk assessment into extraction planning is essential for optimizing holistic patient outcomes. Let's delve deeper into each of these statements, exploring the evidence behind them. To start, let's look at the impact of extractions on systemic health. Several studies published in 2025 shed light on this aspect. For instance, a recent meta-analysis investigated extraction-related bacteremia. Its findings highlight that tooth extractions lead to bacteremia in 62 to 66% of cases, making them one of the most invasive dental procedures, posing an elevated risk of systemic infection or endocarditis, particularly for patients with comorbidities. Another study focused on the systemic inflammatory response after the extraction of surgical third molars. The researchers found elevated levels of CARP, fibrinogen, oxidative stress markers, and leukocyte counts in the first week postoperatively, which returned to baseline by 3 months. These findings suggest that the extraction of impacted third molars can serve as a human model for studying acute systemic inflammatory response. Next, let's examine how extractions affect patients with specific medical conditions. Studies involving patients with type 2 diabetes mellitus revealed that diabetics had lower baseline levels of TNF-alpha and IL-1 beta and a blunted early inflammatory salivary response after extraction. However, they showed a delayed elevation of IL-6 at 2 days post-extraction compared to healthy controls, suggesting altered wound healing dynamics in diabetes. A large-scale observational study investigated the impact of chronic kidney disease (CKD) on the risk of surgical site infections following extractions. The study found that individuals with severe CKD, regardless of dialysis status, experienced significantly higher C rates post-extraction compared to those with mild or moderate CKD or healthy individuals. These findings underscore the importance of preoperative risk stratification for patients with CKD undergoing extractions. Finally, a retrospective ECG-monitored cohort study evaluated the safety of tooth extraction in hypertensive patients. While the study found no increased bleeding risk, cardiovascular events were closely monitored, indicating that careful protocols can ensure safety for such patients. Now let's shift our focus to the potential benefits of extractions. An interventional study published in 2025 examined the effects of full mouth extractions in patients with advanced periodontitis. The study showed significant reductions in systemic inflammatory and thrombotic biomarkers, including CARP, fibrinogen, PAI-1, and white blood cells, 12 weeks after extractions. These findings suggest that eliminating chronic oral infection through full mouth extractions may lead to broader systemic improvements. In addition, a 2025 meta-analysis evaluated the efficacy of high-concentration growth factor (HCHF) during extraction for preserving alveolar bone. The results indicated that HCHF significantly enhanced bone retention after extraction, which has implications for subsequent dental rehabilitation and potentially reducing systemic inflammatory sequelae. So what does this all mean for us? Let's discuss some clinical implications and recommendations based on the 2025 research. First and foremost, risk stratification is crucial. We must identify patients with comorbidities like CKD, diabetes, or cardiovascular disease who might be at higher risk during extractions. For such cases, close collaboration with medical providers is advisable, particularly when there are indications of potential infection or bleeding risks. Moreover, in vulnerable patients, the benefits of extraction should be carefully weighed against potential risks. While long-standing antibiotic prophylaxis for infective endocarditis has been limited, certain high-risk cases may still warrant targeted antibiotic use. However, routine antibiotic prophylaxis is no longer recommended due to concerns about antibiotic resistance. The evidence suggests that extraction-related bacteremia highlights the need for stringent aseptic technique and monitoring in susceptible individuals. Postoperative monitoring is equally important, especially in patients with comorbidities. For instance, after full mouth extractions, tracking inflammatory markers like CARP and fibrinogen can help evaluate the systemic healing response. Close follow-up is also recommended for patients with diabetes or CKD to monitor wound healing and adjust treatment as needed. The 2025 research underscores the need for integration between dentistry and medicine. A multidisciplinary approach ensures that patients receive comprehensive care considering both oral health needs and systemic risks. Open communication between healthcare providers is vital to make informed decisions regarding extraction procedures. For patients at risk, consider alternative therapies or adjunctive measures to optimize outcomes. For example, growth factor use or other strategies aimed at minimizing systemic inflammation during surgery could be beneficial. Additionally, employing minimally traumatic surgical techniques may help preserve periodontal structures and reduce invasiveness, thus minimizing systemic impact. Future research directions hold promise for enhancing our understanding. Prospective cohort studies can help quantify long-term outcomes, such as infection or sepsis and cardiovascular events following extractions in various comorbid groups. Randomized controlled trials comparing full mouth extractions to conservative management in advanced periodontitis will provide valuable insights into the systemic risk-benefit balance. Biomarker-focused studies can track inflammatory and healing mediators before and after extractions, shedding light on systemic responses. Lastly, investigating adjunctive therapies like growth factor use or optimized extraction protocols and their impact on systemic inflammation holds significant potential. In conclusion, the 2025 research paints a clear picture. Tooth extractions, ranging from single to full mouth procedures, significantly impact systemic health. While full mouth extractions might offer benefits for managing chronic oral infections, extractions in patients with comorbidities come with heightened risks. Moving forward, a nuanced, integrative approach considering both oral and systemic health is essential. By embracing this approach, we can work towards optimizing patient outcomes and ensuring their well-being in its entirety. If you enjoyed this quick dive into the latest research, stay tuned for more. We've got plenty more where this came from. Thanks for watching.